Good morning, everyone. I'm Vishal Singh Thakur, MSc Anesthesia from PGI MER Chandigarh. Today, I am presenting my study topic, that is low flow anesthesia is prevalence of use in our institute. It was a prospective observation study. So let me a little bit introduce about the low flow anesthesia. It is a inhalation technique of anesthesia in which at least 50% of the exhaled gas mixture is returned to the patient after the removal of expired carbon dioxide during the next inspiration using a circle system. It is mainly used during the maintenance phase of anesthesia. Low flow anesthesia is not a newer technique, but it is quite older. In 1952, Foldes et al. Described a technique in which nitrous oxide and oxygen mixture anesthesia was given at a rate of 1 liter per minute, and subsequently this was called low flow anesthesia. In low flow anesthesia, the concept is to replenish the consumed gases with as minimum fresh gas flow as possible, while ensuring the removal of carbon dioxide before rebreathing. Virtue introduced the term minimal flow anesthesia, that using a fresh gas flow of 500 ml per minute in 1974. Baker categorized the fresh gas flow as metabolic, which is the minimum requirement of a person in any condition, that is under anesthesia or a paralyzed condition. Minimum flow required, that is 250 to 500 ml. Low flow is generally we consider 500 ml to 1 liter. Up to 2 liter it is medium flow, and up to 4 liter it is high flow, whereas the above 4 liter it is a very high flow. So there is a minimum requisition to implement the technique of low flow anesthesia. For that we need a well calibrated flow meters, a leak-free circle system, use of carbon dioxide absorber, and circuit gas analyzer, which is the most important. There are many advantages of using low flow anesthesia technique, like patient-related techniques in low flow. It improves the flow dynamics, help in preserving the heat and humidity in airway, which preserve respiratory mucosal health and mucociliary clearance, and maintain the body temperature, and thereby reduce the insensible fluid losses. Cost-related advantages are it decrease the consumption of your gases as well as anesthetic agents. Low flow also decrease the cost of anesthesia, total cost of anesthesia. There are also benefit of low flow anesthesia that are beneficial for the environment, like it minimizes the pollution of the OT, and thereby it decreases the pollutants of this OT, that is your anesthetic agents, which are exhaled from the anesthesia workstation, and minimize the exposure of the OT personnel, and does the reduced release of volatile anesthetic agent and nitrous oxide into environment, minimize the greenhouse effect, and also decrease the ozone layer depletion. There are some manageable disadvantages of low flow anesthesia technique, like it takes longer time to achieve the desired concentration of volatile anesthetic, due to which there is slow induction and emergence, and difficult to control acute hemodynamic responses. For that, we have to instantly increase the flow to higher rate, and it requires a reliable gas monitoring system. Faster exhaustion of CO2 absorber is there, so we need to watch for that, and possible accumulation of undesired gases in the circuit system, like carbon dioxide, acetone, methane, hydrogen, ethanol, and compound A. For that, it is recommended to flush the circuit after 1 hour. The observational study which I have done during my academic year, the primary aim of the study was to look for the prevalence of use of low flow anesthesia in our setup, and the secondary aim was to assess the knowledge of young anesthesiologists resident regarding the low flow anesthesia and to explore the obstacles faced in the practice of low flow anesthesia. So after the approval of Institute Ethical Committee, I started the study in elective and emergency OTs. Inclusive criteria for the study was patient operated under general anesthesia with volatile anesthetic agents. Data collected was during a random visit in the OTs. During the study, I watched in the OT, collected the flow rates from the anesthesia workstation, noted the airway devices that were used and inhalation agent that was used during the case. An anonymous survey of questionnaire explore knowledge and difficulty faced by anesthesia resident was also conducted simultaneously during the study. It was observed, there was total 300 cases that we observed during this study, and the maximum case was done with endotracheal and tracheostomy tubes, that was 96%. And most used anesthetic agent, inhalation agent was sevoflurane. That was 56% of cases. If we look for the use of low flow anesthesia, it was very low. The prevalence of low flow was very low. That was around 5.59%, while the maximum cases were done in medium flow rate, that was 1 to 2 liter. If we watch according to the workstation, so most preferably the low flow was used in newly installed workstation, that was a Drager Primus. The reason which I found during the study was that there is a special mechanism in the workstation like economizer, which simultaneously show the flow rate that is required for the patient after we enter the patient biometrics in the their weight and height in the system. So it show that it is a flow is low or high or surplus flow or that is adequate for the case. So by this way, people may to know to come the exact flow rate that is required, and there are maximum use of low flow anesthesia with this machine. As I told, there was a survey to know the knowledge and difficulty faced by anesthesia resident. In this survey, there was total 100 residents from different semester or year. The question was like, what fresh gas flow would you like to, what fresh gas flow do you think is low flow anesthesia? So there was many of people, they said that low flow is 1 to 2 liter, while the low flow is 1 liter and lower. So there is a little bit knowledge gap among residents. So my another question was, what fresh gas flow do you prefer comfortably during the maintenance phase of the anesthesia? So in the people consider the flow between the 1 liter to 2 liter, they best use during the maintenance phase rather than 1 liter per minute. My next question was, how long after induction do you decrease the fresh gas flow to low flow? The most answer was that was between less than 5 minutes, and usually it is came to know during the studies that we should usually implement the maintenance phase during after 15 to 20 minutes of the during the after the induction, so the gases can get constant concentration in the circuit. The next question was, how have you ever tried the using a fresh gas flow of 1 liter or less? So 76% of the person said that yes, they have used the low flow anesthesia. Next question, next question was, in your opinion, what could be the adverse effect of the low flow anesthesia on the patient? So there was various answers for that. Some consider there is no effect. Hypoxia was told by 48% of the person. Respiratory failure was also considered by 4%, and 47 this 1% was said that it was unstable hemodynamics. Next question was, in your current understanding, do you believe that anesthetic gases have any effect on the environment? So maximum resident answered that it can cause the greenhouse effect and deplete the ozone layer. So this shows their knowledge update during recording about the effect of anesthetic agent on the environment. My next question was, what do you feel about the practice of low flow anesthesia? 48% people said it is easy to learn in practice, while 32% considered easy to learn but difficult to practice. And there were person they said it is difficult to learn as well as to practice. My next question was, in your understanding, can low flow anesthesia preserve heat and moisture within the breathing circuit and prevent heat loss and drying of the airway during the general anesthesia? So there was 75% people who said yes, it does the retain the heat and moisture within the circuit. My next question was, how likely will you use low flow anesthesia for cost cutting of volatile anesthetic agents? So 75% resident vote in favor of using low flow anesthesia for the same. My next question was, what are the possible reasons of not using low flow anesthesia in routine? So 48% residents consider that it is due to the lack of monitoring and equipment malfunctioning, which prevent the use of low flow anesthesia. And there was also a lack of knowledge between the resident that prevent them to use low flow anesthesia. That may be their fear to use the low flow anesthesia. They are also low experience, which prevent the use of low flow anesthesia. In discussion, during the study, about 62% of cases were observed in medium flow, and only 5.6% were used in low flow anesthesia. That shows the very low prevalence of use of low flow anesthesia. While assessing the knowledge of residents during the survey, 50% of the residents were aware of definition of low flow anesthesia. That was 1 liter per minute and less. 28% considered fresh gas flow of 1 to 2 liter per minute, and 11% considered fresh gas flow of 2 to 4 liter as low flow anesthesia, and this shows the knowledge gap among the residents. Low flow anesthesia was less preferred with the sevoflurane, that was 9%, while then isoflurane, that was 17%. 48% residents even felt that hypoxia could be a problem when using low flow anesthesia. Continued monitoring of inspired O2 concentration is recommended during the use of this low flow anesthesia to avoid the hypoxic mixture to be delivered. 75% residents were also aware of reduction of cost of volatile anesthetic and benefit of patient as well as the environment protection by using of low flow anesthesia. Volatile anesthetics volatile anesthetic account for about 25% of expenses during the anesthesia practice. So by lowering the flow, we can decrease the cost. 40% of the residents cited a lack of proper monitoring facilities and equipment malfunctioning as a major hurdle in use of low flow anesthesia. While training the young resident routinely can improve this practice. As well as continuous displaying real-time message on the anesthesia information system or anesthesia workstation display, help reducing the practice of using high flow and increase the practice of low flow anesthesia. In some summary, we can conclude low flow anesthesia, well established technique, beneficial to patient, decrease environment damage and lead to a significant cost saving. While In the prevalence, we have seen 60% of cases were doing in the were done in the medium flow, whereas the 5.6% were done in low flow. So we can say that there is we can after implication low flow escape, we can save a lot of this our anesthetic agents, save the environment, and it can beneficial. It will be beneficial for the patient. Although it is easy to learn and practice low flow anesthesia, a fear of hypoxia is still there among the practitioner or anesthesiologist. Low experience and knowledge gap is also a factor. Issue like lack of basic monitoring and equipment malfunction have a major role in preventing of low flow anesthesia. So that's also. Thank you.